Hey, what's up, Smart Chiropractors? Dr. Jeff, part of your Smart Chiropractor team here. And I wanted to break down a study that I think is super important. It's a new study out. I just recorded a podcast, but the stats were so alarming. I wanted to come in and talk about it, break it down for a minute. It's this guy right up on the screen right there. And it is brand new. And the question that it really proposes to me is chronic pain actually being fueled by poor decision-making in primary care doctor practices? And the answer looks to me to be an overwhelming yes. You can check out some of the key stats in the description here, but it's estimated that 13% of people in the US, adults, have chronic low back pain. It's estimated that about a third of people have chronic pain and 13% have chronic low back pain specifically. Now, we've known for a long time that primary care physicians really give a lot of guideline discordant care. We've seen that through multiple papers, but this really crystallizes why this is such a big deal and why you need to take proactive steps in your community to make sure that you get out there to really truly save the lives of individuals that are in and around your practice. We know that when there is non-guideline concordant care, which is most often the case, that this leads to increased opportunities for surgical intervention, opioids, all the kit and caboodle. So you getting in there, whether it's through the Smart Chiropractor, making sure that you're getting out there to your community with positive messaging, email, social, video streaming, this stuff is critically important. It's not only to help build and grow your practice, but this is literally to be why you became a chiropractor, which is to help people make better decisions for their health. Now, this study broke down basically three things, saying these three items are the most common guideline discordant items that primary care physicians recommend. And number one is opioid prescriptions. You may be shocked to hear this, but 30% of people going into primary care physicians less than 21 days after their initial visit have been recommended opioid medications for low back pain. That seems absolutely like we're living in crazy town, but I can tell you over the last year, everything that's occurred wiped out all of the gains that happened on the opioid epidemic the years prior to that. We have seen now more deaths, more challenges, and ultimately more devastation this past year than we have in many years before, which is no surprise. But I'll tell you what is a surprise is that up to 30% of individuals are getting opioid prescriptions in a primary care office for low back pain within 21 days of that initial visit. I'm going to say that is completely unacceptable, and that healthcare associations and organizations need to start taking this stuff seriously. They need to batten down the hatches and need to hold doctors accountable, because at this point, that should be just deemed frankly unacceptable. Now, the other aspect of non-guideline concordant or guideline discordant care is early imaging. If somebody visits a primary care physician, they're not doing anything with the X-ray, an MRI, or a CT scan, except for probably referring it on. But we see that many people are still getting X-rays, CTs, and MRIs in primary care offices when they're really just going to refer the patient out to begin with. And the final piece is that referral. We see that a lot of people are still being referred out to surgeons within 21 days of initial onset of care. Again, there is nothing to showcase that that's the way things should go. I don't know when or who would say they were ever trained that way. However, it continues to happen day in and day out, and it's happening in your community today, right now, maybe with people you know. This is why I'm so passionate, and we are so passionate with the Smart Chiropractor to get out there and say, you need to get your message out, because we see these things happening time and time again. Building relationships with other healthcare providers, critically important. Getting your message out so people don't go down this road is also super important. So I'm checking my notes on the side of the screen here. And basically they found that at 32% of people transitioned from acute to chronic low back pain at 6 months, almost 30% of people. That leads to that 13% of the total population. We also know individuals who receive a guideline discordant recommendation are more than twice as likely to develop chronic pain. So we could literally be cutting these numbers in half if these docs were doing what is in the guidelines. And that is why it is so important for you to get out there with your messaging to ensure that everybody in your community has every opportunity to take advantage of the care that you deliver. And this is a real thing. Ultimately, the final stat here is 48% of people received at least one discordant piece of care within 3 weeks of that initial visit. And they go on to say this resonates with what they've seen in a claims analysis of over 2.5 million. So this is just the way it's going, right? 1 in 2 people are either going to be recommended opioids, CT, MRI, or advanced imaging, or referred on to a advanced intervention within 21 days. That is a crapshoot that I don't love those odds. Also, when I brought this up on the podcast, but I used to work with a fantastic surgeon. I thought he did great work. And he told me, quite frankly, he's a spine surgeon. And he'd say about 30% of his patients are better, about 30% are worse after surgery, about 30% are roughly the same. Now, I can ask you as a chiropractor and say, man, what percentage of patients that come into your practice are better off than when they came in? You're probably going to tell me 80 to 90%. So I hope this is compounding why this is so important, why the messaging, the communication, why are we talking about social, Google My Business, Facebook, Instagram, email contacts? Because it's important. And because if we know that over half of people, just about 1 out of every 2 people, a 50-50 chance that they're gonna walk in and get a bad recommendation. There's a 30% chance they're gonna be recommended an opioid. There's a 25% chance they're gonna have advanced imaging. There's a 15% chance they're gonna get recommended to go to a surgeon within 3 weeks. Having people early on understand who you are, what you do, and the benefits of your care can absolutely change the lives of people in your community. But the number one thing you have to do is get out there. Just going to your networking, breakfast at once a week, that's not good enough. That's not gonna cut it. You need to get out there more. You need to get out there in a way that really canvases your community with these messages. Because if they go into these primary care physicians, if they're getting these recommendations, now you're at a disadvantage and it's an uphill battle. I know all of us as chiropractors have had patients come in and they might have seen us, and then directly after seeing their primary care or something to that effect, and they stopped coming in to see us because their primary care said, oh, you need a prescription. You don't need a chiropractic, you need a prescription and to go see my surgeon friend. And it's crazy, but it's still happening today. And it's affecting the lives of people, and it's pushing people from acute pain to chronic pain, which means they're getting sensitized, which means they're, literally the brain chemistry is changing as they develop those pathways. It means that their habits and psychology is changing as we know what occurs when people go from acute to chronic pain. So I hope this emphasizes the fact. I dropped the link down below if you want to check out the study itself. I'm featuring this on a podcast next week if you want to check that out. But bottom line is, get out there, tell your story. It is needed now more than ever. We're gonna see a lot over the course of the next few months in terms of opioids and how that has raged back. Chronic pain goes right into that. So get out there, have a great Friday, get your message out to as many people as possible. Keep up the awesome work. If you have any comments, questions, or anything else, leave them down below. Thanks for being a part of this awesome group. We're super happy you're here. Invite chiropractic friends. If you have some great friends that are chiropractors that are not yet in this group, encourage you to do so. Have an awesome day. I'll see you soon. Bye. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.